Hello, my name is Dr. Laurier Fagna. I'm a professor of music and vocal singing and choral singing at the University of Alberta, where I direct choirs and teach singing. And I have been working most of my career on how to make beautiful sound in singing. If you're going to sing beautifully, you also have to breathe beautifully. And breathing is where you create your instrument. So today we're going to take a look at that first part of breathing, of how to breathe in the most holistically advantageous manner possible, both anatomically, physically, but also to get the most amount of air in, and then to be able to retain and control that air so that you can make it through long sentences, or if you're singing, long phrases on one breath. So the first thing that we're going to talk about today is posture. Posture, your body is the vessel, and it's the vessel of your instrument. So the way in which you stand or sit is very important as to the amount of breath that you're going to be able to take in, and then how you're going to be able to control that breath. I like to think of gravity as being up there as opposed to down here, because if we think of it as being down there, we slump naturally towards it and we get all crunched up and not a lot of room for breath. So if we think of gravity being up there and lifting us through a long neck, all the way from the crown of our head and also from our sternum, that opens up the entire thoracic cavity. A good way of testing out your posture, thinking gravity up there, also taking your thumbs and kind of rolling them back like this. That opens up your chest cavity completely, and then just letting your shoulders drop without letting your chest drop with it. Important to kind of have your knees loose, though. You don't want everything to be tight. You just want things to be lifted and buoyant. Now that we've got everything opened up, we need to think about how we're going to take in the breath. And this can be fairly tricky because some of us think that when we really use our voice to project, we think that we need to take a big breath up here somewhere and fill up the top of our lungs. And we end up just crowding ourselves and over-pressurizing the breath in our body, which is not the best way to go about it. Instead, breathing inhalation is basically a passive action. As soon as we make it very active and we suck in breath and we put effort into it, we're going to take less breath, and we're going to put it in a place where it is not controllable and where it has to, if you take a chest heaving breath, Newton's third law, each and every action deserves an equal and opposite reaction. Fill it up with pressure, it comes out with pressure. So instead of that, we want to take the breath nice and low. Now that we've got our posture nice and opened, the diaphragm, which is a large dome-shaped muscle, and the lungs are tied to the bottom of the diaphragm. Let's just see if we can get a quick diagram of that, knowing that I'm not a visual artist. Breath has to go through the vocal folds. There's no other way. It has to go, the vocal folds need to be open so that the breath can drop in through the trachea and then go down further into the lungs. We have to have the doorways open if breath is going to enter properly. The doorways being there, and here. In order to get rid of the obstacles that can impede breath getting into the body, and that can impede, if we're talking about vocal production, whether it's for speaking or singing, impede good vocal production. One of these things can maybe not be working properly in order to open everything up. So a couple of images that I use are those of a trap door. If I were standing on a trap door and the trap door suddenly gave way, I would be gone. So in your body, in your anatomy, you have two trap doors when you think about breathing. One is the vocal folds, which can be very closed and impede the breath. And what you're hearing there is the friction of breath trying to beat its way past a closed throat and closed vocal folds. And it's an obstacle. So we need to get rid of that obstacle. So we need to think of that as a trap door. My body in this image is the breath waiting to drop into the bottom of the lungs. The trapdoor is the vocal folds. And there needs to be a very passive, easy opening, a yawning feeling at your vocal folds, which are in your thyroid cartilage or your larynx right here, and they vibrate like this. They're much like lips, but they vibrate back and forth, or they open up for breathing. So they need to get completely out of the way, and the test is, does it make noise? If you get that obstacle out of the way, breath goes whoop, poof, and drops very quickly where it needs to drop. The other trapdoor is the diaphragm. Now the diaphragm separates the lungs from the viscera or the organs, and the bottom of the lungs are actually attached to the diaphragm. So when the diaphragm descends, the bottom of the lungs open up, descend and open up this extra space down there. Which is very important because that creates the vacuum that is going to call the breath down there. It's going to invite the breath to just drop in easily. If that vacuum doesn't happen and you breathe like this, then you're going against nature. We can breathe in like this, where the diaphragm is not really allowed to descend and all of the abdominals are pulled in and breath is pressurized in the top of the lungs. Or it can be allowed to descend, bringing the bottom of the lungs with it because they're attached to the diaphragm, the bottom of the lungs. And that creates open, empty space or a vacuum in the bottom of the lungs. Nature, we know, abhors a vacuum, and breath simply appears from up here after you've let this trapdoor and that trapdoor go. The emptiness is here, and it just gets filled with what is up here without having to suck in the whole room. And that's what you want in singing. And in life, this will help to get more breath into your body for sure, and to be able to better use what you've taken in. Another image that I like to use that's similar to the trapdoors in a way are the three lips. We may not know it, but we all have three sets of lips. We have one right here, of course. We have one right here. The vocal folds are also, they're very much like lips, much smaller, but instead of being this way, they vibrate open and close this way. And then you all also have a set of lips here, the front lip and the back lip. You might not have been aware of it, but I'm teaching you something new today. So as you, the thing is that in a good inhalation, those three sets of lips are one system that yawn simultaneously as soon as you think about the act of inhalation, of taking a breath. And a good way of feeling this is putting the hands around the ribs like this with the thumbs against the back ribs, and then to slightly lean over and to think of a simultaneous yawn here, here, and here. So it's the trap door thing, but we're adding the mouth here as well. So three sets of lips that yawn simultaneously. And as you lean forward, your thumb should feel the back of the ribs, the floating ribs, opening up. Why? Because the bottom of the lungs that have that vacuum created in them, breath is now dropping into them and kind of pushing things out of the way, maybe pushing the organs. You should feel a three-way expansion at the bottom. And see if you can keep that feeling, that end of inhalation feeling as you speak, as opposed to letting everything out. Trying to keep that nice open feeling so that you can actually use your voice to make beautiful sound, whether it's speaking, whether it's singing, so that the vocal folds can vibrate super efficiently without having all of this extra breath exploding them and compromising their action. But the nice thing about this is you're letting breath drop into the bottom of the lungs. You're using the opening of the ribs and of the intercostals. Intercostals mean between the ribs, the intercostal muscles, which will hold the ribs open which will keep the breath in this lower reservoir and keep it away from the thing that you're trying to make beautiful sounds with, the vocal folds and all of your resonators. So you take in a lot more breath this way because you're opening up extra space in the bottom of the lungs. And it's a much nicer feeling actually in everything above the lungs. So you want to create the environment which allows breath to drop silently, easily, immediately, without being sucked in actively, passively drops into the bottom of the lungs. And then the next thing that we have to do is stay there so that the breath that you've taken in can be used according to the sound that you want to make, instead of just collapsing and then breathing in and then collapsing. We want those trapdoors to release, breath to drop in, and then to stay there. So we have to trick the body, once we've got the bottom of the lungs full, into keeping that breath open. So great exercise is to just put your hands here. And once you've taken in that nice big breath, not big up here, you still feel kind of open and empty here, but nice and full down here. To kind of try and stay there and speak and keep your chest nice and high and your ribs nice and open. And then that actually uses very, very little breath. So instead of filling up and then emptying, we're going to fill down and then keep that open and then and then all of your resonating system is nice and empty and ready to resonate beautiful sound. And there's no pressure beating at the vocal folds trying to get out. Because it's all down here. And after you learn to keep these muscles open, that will enable you to sing or to speak long phrases and to control that breath that you've taken in so beautifully, holistically, harmoniously with your body.